Hello, everybody. We're back with session 13, and I have here Douaa Mohamed, and she's going to be presenting a poster entitled Surveillance System Enhancements for Mass Gathering, a Systematic Review Protocol. We're very fortunate to have her here with us. It's midnight where she is in Qatar. So thank you for joining us today and look forward to hearing your remarks. I also want to note that the order of authors is not quite as it should be, but we will have that updated when we publish all these posters in HPHR Journal. But without further ado, I'm going to stop talking and hand over the mic to our presenter.
Thank you very much for giving me the opportunity to present this poster today, and it will be an honor for me to present it and to join you here. My poster is about surveillance system enhancements for mass gatherings. It is a systematic review protocol describing a systematic review that me and the review team is conducting now. We reach the result synthesis stage. So I shared with you the protocol. So mass gatherings attracts annually vast numbers of people around the world, and this influx of people will eventually increase the public health threats in that destinations. So to like response to public health threats, we have to implement a strong surveillance system. And till now, there is no a systematic review describing the previous surveillance systems implemented for mass gatherings. So this will be the first systematic review to describe this. And the main objective of our systematic review is to summarize the surveillance system enhancements in preparedness for mass gatherings. As you know, mass gatherings are like events of many people or a huge number of people in certain place for a certain period, like what's happening now in Qatar, the FIFA World Cup 2022. And this is the main reason behind this review. Okay, this protocol is registered in Prospero, which is the International Prospective Register of Systematic Reviews, and here I shared the registration number with you. And our methodology, we followed the Prisma guidelines. Started with searching with the search strategy. We used both mesh terms and free text, and we searched 5 different databases, which are Scopus, Web of Science, ProQuest, Medline, through PubMed, and Embase. Also, we searched Google Scholar to retrieve gray literature. After that, we worked on the eligibility criteria, the inclusion and the exclusion criteria, and we have included all the English articles that published on 2012 and onward, and also the articles that describes how they enhance the surveillance systems for mass gatherings. Other articles, which include epidemiology of infectious diseases, were excluded. We are not looking at the diseases or the epidemiology of the diseases, but we are looking on the enhancement made to the surveillance systems. So After that, for the article selection, we do the article and abstract screening. It's done by two independent reviewers, and then after we finished that, we started the full text screening. Also, two blinded reviewers performed the full text screening, and we used Rayan platform for systematic reviews to perform this task. Um, Also, we did the quality assessment using the STROP checklist. Sorry, I think my baby is awake now. Okay, and also after we finished the quality assessment, we started the result synthesis, and we divided it into four tables and three main themes. The first one is how the previous surveillance systems list the priority diseases to be monitored during the mass gatherings, because listing the priority diseases is of high importance to if you to early detect and response to public health threats, and also defining the data sources for the surveillance system. Nowadays, we found like media, social media can bring us with early signals earlier than like physicians from hospitals. So there is new technologies used in surveillance systems. Also, choosing the most appropriate surveillance approach, which there are many approaches can be used in surveillance systems, like syndromic surveillance system, indicator-based surveillance system, uh, event-based surveillance system, sentinel, and the epidemic intelligence, which is the most advanced and new system. Um, this review will be the first to summarize the surveillance system enhancement in preparedness for mass gatherings, and we will consider this as a legacy after the FIFA World Cup will over. This is it. I hope that we can finish it and publish it soon, so everyone can get benefit from it and use it to for the future planning for mass gatherings. Thank you. Thank you very much.
Thank you so much for that really interesting presentation. And again, I know it's very late for you. Thank you so much for joining us live and presenting this incredible research. We look forward to hearing more. This poster is going to be available on HBHR Journal along with the other presentations that we had on display today. And look forward to staying in touch and engaging in other contexts as well.
Thank you very much. Thank you.
Okay, we'll get some sleep. It's not too
Thank you very much. Good night or good evening.
yes. Bye bye.
Bye bye.